Welcome everyone again to our presentation today on respiratory season updates, cold, flu, COVID, RSV, and more, what you need to know to stay safe and well this respiratory season. We're very happy to have Dr. Latif Murji presenting with us today. Dr. Latif Murji is a family and ER physician based at SCHC. Dr. Murji is the founder of the widely acclaimed VaxVax Plus Clinic, a groundbreaking initiative that addresses vaccine hesitancy through physician-led phone conversations, and is now broadening its scope to include cancer screening and other preventative health measures. His work with VaxVax has garnered national media attention and serves as a blueprint for engaging communities in health literacy. Dr. Murji is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenets of experiential and transformative pedagogy. He is the founder of the nonprofit organization Stand Up for Health, which delivers immersive health learning experiences to train healthcare workers in health equity and advocacy. By night, Dr. Murji showcases his artistic flair as the lead vocalist of the indie alt rock band Parachute Thieves. And so we're excited to be able to get to today's conversation. And Dr. Murji, I'm happy to hand the mic over to you now.
Hello, can you hear me?
Yes, we can.
Okay, awesome. Thank you, Amy.
Yes.
We're going to be talking all about the respiratory season, which includes the viruses that are coming to get you soon. That's the cold, colds, flus, COVID, and RSV. And we're going to talk about vaccines around that as well. Let's get into it. So I'm going to share my screen, what presentation we've got for you. So just give me a second. Let's see if we can get this working.
And as a reminder, you can put all questions or comments into the chat. If you'd like to ask the question privately, you can send it directly to myself and I will bring it forward in an anonymous manner.
Okay, can you see the presentation now or
Yes, we
no?
can.
Yeah,
Yes.
full screen, good. Okay, awesome. All right. So yeah, feel free to ask questions at any time. But I'm just gonna go ahead and start. All right, so a little bit anatomy lesson. There's going to be some slides that we spend more time on and some that we just kind of flow through, okay? So this is just to remind you, this is the system of the body we're talking about, okay? So usually air comes in through your mouth or nose. It's better if it comes in through your nose because it gets cleaned on the way in, and then it goes into your trachea, which is your windpipe, and then into your right and left lungs, and that's where gas exchange happens, and that's how you get oxygen into your body. However, because we need to get oxygen into our body, we can accidentally get in other things like bad guys, and this is how infections happen often. They're very contagious. So what's a cold? Cold, everyone's heard of this. It's probably the most common type of virus that you can get in the upper respiratory system. So I guess one of the things to realize here compared to this slide is a cold doesn't affect your lungs. Okay. It affects the things above the lungs. So it's kind of up in your face, in your head, in your nose more. And if it affects your lungs, then we would be talking about something way more serious than a cold. And we would be talking about something like a pneumonia, for example. So a cold is just kind of the lightest infection you can get. So all these things we're talking about are viruses, okay? A cold, usually the virus that is the culprit is called a rhinovirus. But there's so many different types of viruses that call a cold that are called colds. The word cold is obviously a colloquial term. It's not a medical term. But we use it. We don't really say, hey, you have a rhinovirus. That's weird. Okay, so we just say that's a cold. And how are viruses spread? So generally, a cold would be spread through contact or droplets, but other things can be airborne, such as COVID. Okay, so contact is when you touch someone or something. Droplet is literally the tiny little droplets in your mouth they get sprayed when you talk or cough or sneeze. And if you're close enough to someone, that droplet can land in someone else's mouth or on their hand, and then they touch their mouth later, which is why it's good to not touch your face a lot, especially in the fall and winter when these viruses are being passed around. And COVID is different because COVID is airborne. So it's you can just be in the same room as someone, and eventually, if you spend long enough, if they have the virus, you end up getting it because you're breathing the same air. So we talked about this already. Cold is more droplet. Okay. So as I mentioned, that's coughing, talking, sneezing mostly. Now, who can get a cold? So this I want to generalize this more to who can get infected with a virus, which is anyone. However, with all viruses, the people we're most worried about are children and seniors. These are the two groups of people that get very sick, and they're more likely to get sick. And when they get sick, they get hit harder. Children haven't seen as many viruses in their life so far, and they're also touching everything and licking everything and hanging out with each other. So then they're passing all these viruses around to each other. If you have ever been to a daycare or know a kid who's in daycare, you'll know that they're always getting sick. And then that makes you sick. Not fun. And then older adults and elderly people, their immune system is experienced. However, it's getting older and it's getting weaker. And then it becomes susceptible again to getting hit harder by a virus. As I mentioned, these viruses are seasonal. That's why it's October and we're having this uh, lecture or conversation today, because tis the season. So usually late October, November, December, January, February, March, and a bit of April are the is the bad season. Okay. So that's when most of these viruses are more common. And COVID is less seasonal, but all the other viruses are definitely very seasonal. So colds, flus, and RSV. Part of the reason is because the rhinovirus, remember I told you about this virus? It actually is activated in colder temperatures. So your nose is literally colder as you walk around outside in the winter, and that activates the virus and makes you sneeze more, and then it spreads. So everything just spreads more. And then also people end up being indoors as much as they can, and then they're just sick and crowded and things spread fast. Okay. So we're going to talk a little bit about how you determine if something's a cold or a flu or COVID or whatever. So with the cold, as I mentioned, you generally have, it's more like congestion and runny nose and sneezing and maybe a little bit of a sore throat. But it's very, overall, it's mild. Okay. It's like a nose-based virus. The flu is very different than the cold. Okay. They're both viruses, but the flu, also known as influenza, hits you much harder. Okay. And the flu is what can kill seniors usually, um, not a cold. The flu, the key thing I want you to remember is it's usually you have a fever with it and your muscles ache. You feel really sore. You just feel like you got hit by a bus. Okay. So why are we getting viruses in the first place? Well, the viruses tend to find us when we are most vulnerable. And so if you, let's say, had a all-nighter, or you're looking after someone, let's say, and you're not getting sleep, or you're studying for an exam, you didn't sleep, you're fatigued, you're tired. Or let's say you're going through a really tough time emotionally, you just broke up with someone, you're emotionally tired, or you didn't eat enough, anything like that. Or you could just have a predisposed, like you have a weak immune system. The virus will find you. They're opportunistic, and these are things that make your immune system vulnerable and will make you more likely to get infected by a virus. And the other thing that people sometimes forget, or maybe they never knew, is that when you have a virus, you're getting attacked and then you are vulnerable to another virus. So sometimes people can get sick for weeks, and often that's because they actually just got hit by a virus after virus after virus. That actually happens all the time, and it's very unfortunate, which is why it's best to just not get sick in the first place, protect yourself as much as you can by getting good rest and by eating healthy and by getting vaccinated. So what happens once you get sick? Well, it's a virus, so antibiotics will not work. All that we can do is rest, fluids, and Tylenol as needed. COVID is an exception where there's a medication called Paxlovid that people who are elderly qualify for, but or if you're immunocompromised. But other than that, there's not really anything you can do for a cold or a flu or anything else, or any of these viruses. You just gotta rest, fluids. Okay, so symptoms of the flu. As I mentioned, the key thing here is the fever and the muscle aches and the soreness. You can also have the usual, runny nose, stuffy nose, sore throat, cough, some congestion, whatever. But those are the hallmarks, and a headache. You wouldn't really get a headache with a cold either. Okay, so now the more fun parts. RSV. I'm sure we're all hearing more about RSV these days. So this is a virus, respiratory syncytial virus. And this is also a major viral illness that causes a lot of morbidity and mortality amongst babies and elderly people. That means people get sick, people die from RSV. So it's important to know what it is. The other reason why everyone's hearing about it now is because there's a vaccine for this now. Okay, so it's awesome. So you might have heard of this disease called bronchiolitis. This is a chest infection that babies get very commonly, and they get really sick from it. And usually every baby will get this at least once. So it's very common. So if you have a baby or had a baby, you will know about this. It's caused by RSV. And RSV is peaking in November through April, just as I said, that's our respiratory season, right? So it's coming for you. All right. So as I mentioned, most kids will have at least one RSV infection by age 2, and the symptoms are very similar to a cold or flu, except that usually this happens in a baby. So that's one way to know what it is. And the baby will be wheezing. So that's another. So the point is, you don't have to make this diagnosis. So don't worry about it. But if a baby seems to have a viral illness, you bring them into the emerge because it could be RSV, and this is a serious um, virus. Okay. Another way that we detect illnesses in babies is when their intake or output decreases. So they are not drinking as much, let's say, milk, or they're not having as much water or feeding as much, and their urine output, their wet diapers decreases, or they could be more irritable, or even worse is when they're just like really, really tired and not really moving much. We call that lethargy, and that is a sign that bad things are happening. So how is this spread, RSV? Same kind of thing as a cold and a flu. This is a droplet. So if someone who's infected sneezes or coughs or talks around someone who is uninfected and they're close by, that droplet could end up on that person. Okay, so now the moment I've been waiting for. We're talking about vaccines to RSV. So Abrezvo is a new vaccine that Health Canada approved, and this is approved for elderly people, people who are 60 and up, as well as pregnant people, so that the baby can be protected through passive immunity. It's one shot, and it's given in pregnancy between ages or between 32 and 36 weeks of pregnancy. If you give it later, it's too late, because the antibodies won't be built up by the pregnant woman. So remember, the idea is the mom gets the shot, then the mom builds antibodies against RSV. So the mom's immune system is stimulated. And then those antibodies pass through the placenta to the baby. And then the baby has these antibodies. And the baby didn't even do any work. They didn't build the antibodies themselves. They just have them. And that will protect the baby. Okay. So that's how Abrysvo works. And then with elderly people, the person just gets the shot, and then now they're protected for at least a couple seasons of RSV. We're still waiting for research to see how much the duration of the immune protection is. But for now, you just need this shot once. Okay. So now how about the funding? We know it's approved, but what about the funding? So it's approved for adults over 60, but it's only publicly funded in Ontario for adults over 75. And if you are 60 plus and living in long-term care or a chronic care facility. So for example, if you are over 60 or your parents are over 60, let's say you're 62 and you live at home and you're a healthy or generally healthy person, you can get the shot, but the government will not pay for it because you do not live in a long-term care center. So then what do? Well, I would still recommend you get it. The problem is that given the current funding model, you will have to pay for it yourself unless you have benefits that cover it. And from my understanding, this costs around $250. So it's a lot. It's what it is right now. There's nothing I can do about it. This is just me passing on information. At least this exists because a couple of years ago, this didn't even exist. Okay. So RSV still existed a few years ago. This vaccine didn't exist. Now it's an option you have. If you have the money, you can pay for it. And why is the government covering it only for these groups? Well, they are determining that these groups are more at need for uh, the vaccine, and it will save healthcare dollars in the long run if those groups get it. Okay, so now on to the second part of this slide, which to me is even more exciting. Okay, so this is great news. There's something that's even better than this vaccine for the babies and the pregnant women. Okay, so this is not going to help the elderly people, but this is Beyfortus. Okay, this is not quite a vaccine, but the result is the same. You get injected, the baby gets injected with this as soon as the baby's born, and it gives the baby the same antibodies. So remember, the mom, when she gets the vaccine, is making antibodies and passing them through the placenta. Well, those same antibodies are just given directly to the baby when the baby's born in the form of Beyfortus. There's a new product, and it turns out that it works super well. We're going to get into the numbers, but it's better than the Abrysvo vaccine for the babies. So this is preferred for the babies. So it's also publicly funded this year for the first time. So any baby that's born in 2024 or a baby that's born, now, because it's RSV season, will automatically get this Beyfortus. And let's say you have a friend, they had a baby that was born in July. Well, they haven't gotten Beyfortus, but they're eligible. So when they see their family doctor for a 2-month, 4-month, 6-month visit, they should get Beyfortus because it will protect them for RSV season. And let's say you had a baby born in 2023, but they have some sort of condition, with their lungs or any sort of immunocompromise, they should go to their family doctor and get Beyfortus so that they are protected against RSV for this season, even though they're over 1 year of age. We have something in the chat here.
There are a couple questions that have come up in the chat. One question regarding sort of access to RSV vaccines. Where can patients access this? And then there's another question specifically with Beyfortus. If you have an infant that had the RSV, how long should you wait to administer the Beyfortus or even the
Abruzzo.
asperazole? Thank you.
Okay, so what's the first question? Where do you get it?
Yeah, sort of where can individuals access the RSV vaccine?
Yeah, so I mentioned that okay, so let's say you're an elderly individual in the first two groups up there, 75 plus or 65 plus living in LTC. So if you're living in LTC, they're just going to come to your LTC and offer it to you. Okay, so you just keep living where you're living and the people will bring you the vaccine and you'll get it. If you're 75 plus and you're living at home and it's also publicly funded for you, you can go to your family doctor and they can write you a prescription for it. If you are, let's say, 60 plus and you don't live in LTC, so you're going to pay out of pocket, I believe you can just go to the pharmacy and pay for it, and the pharmacist will give it to you right then and there. If you're pregnant, 32 to 36 weeks, and you want to get a Abruzzo vaccine, apparently the OBs don't have it. So you need to go to your family doctor again, and then you'll get it at the pharmacy because the family doctor will write you a script, or the family doctor will give it to you right there. If they give it to you with a script, then the pharmacist will give you the shot and it'll just get covered by the government. So that's for all the access. Those are the logistical ways, which is still being sorted out because it's the first time they're doing this. As I mentioned, where the Beyfortus, the access is at the hospital for babies that are born now and babies that are born before now. Like let's say a week and before that, they would have to go to their family doctor and get it there. What's the second question? Amy?
Speaking while muted. If you have an infant that had the RSV, how long should you wait to administer the Beyfortus vaccine?
So I don't know this. I haven't read this anywhere. I'm pretty sure you can give it regardless. So first of all, you can't give a Abruzzo. So this would be Beyfortus that you're talking about. So I would just
Sorry, can I just jump in? It was my question.
Yeah.
So my question is, if there's an infant that shows up that's already been, I guess, exposed to RSV, how long does the immunity wane off? Like, when would you consider doing the injection of the Abruzzo?
So I think you're asking about Beyfortus. So I wouldn't
Either or, because Beyfortus is only available in the hospital, right? So in the community,
No,
it
it'll
would
be in
be
the
a
community. That's
Abruzzo.
what I'm saying it's going to be in the community. It's going to be in both. So any baby that has been born before now, because only this very moment it is arriving in the hospital. So any baby that's, let's say you're born in June 2024, you can't just go to the hospital. They don't have the capacity to deal with 100,000 babies coming in. So you have to go to your family doctor. Your family doctor should have Beyfortus in the coming weeks. And then that baby who is now like 5 months old will get Beyfortus. And if they had RSV, there's no guidance around that I've seen, but I would just give them Beyfortus anyways. There's no harm in giving someone a monoclonal antibody, even if they've been exposed to a virus before. Does that make sense?
Yes, thank you.
No problem. Okay, cool. So let's continue along. So now I'm going to talk more about Beyfortus. So this is maybe a little bit too much detail for some people, but if you are curious, number one is basically saying we used to have this other thing that was palivizumab, Synagis, and that needed multiple injections and it's gone. Okay, so forget it. Beyfortus is the new thing, and it's great because it just needs one injection. Okay. Two is saying that both of these are monoclonal antibodies, and I already explained to you what this is, and this gives you passive immunity. So you just get the antibodies directly, which is great. So your immune system doesn't even need to do the work. Number three is saying that this Abrezvo vaccine, right, the one for the pregnant women, that one needs to be given 32 to 36 weeks, and it is currently available. And number four is saying the bottom line is that Beyfortus is better than Abrezvo, and so it is the recommended solution, basically, for the problem, which is RSV in early years. Okay, so this is why. It's because Beyfortus is better. Okay, 80% effective in preventing medically attended RSV. 81% effective in preventing lung infections that require hospitalization, and 90% effective in preventing RSV-associated lung infections leading to ICU admission. So this is fantastic, okay? These numbers do not compare to any other treatment or vaccine that we have for RSV. So how long does Beyfortus work? It works for about 6 months. So that's why if we want everyone to get this injection, all these babies to get it around now, let's say October, November, because then they're protected for the whole RSV season. After April, May, there's not going to be RSV going around, so we're good. So that's why right now is a great time to get this Beyfortus for all the babies born in 2024. And so people ask about side effects. These side effects are just the typical side effects that you get with an immunization. So just like swelling at the injection site, some pain there, and maybe a bit of a fever. Okay. So we're done with RSV for now. Let's talk about COVID. Some people may have heard of this virus called COVID. It's the coronavirus. And you may remember that there's all these variants. So I'm sure everyone remembers the Omicron variant. That is still going, okay? All the variants since then, it's been Omicron since about 2022. They're all subvariants of Omicron, okay? Omicron is the most contagious one, and it's just been evolving within itself, basically, okay? So the latest one is KP2. This is what some of the vaccines that we have now are based on. And as we know, COVID is airborne transmission, but you can still get it droplet. So don't make out with someone if they have COVID. All right, so how do you manage it when you have COVID? Well, you isolate, as we know. And a lot of people these days have been vaccinated, which is great. And that's why we're seeing milder and milder illness. So let's continue along. I think people know these things. COVID, many of you may have had it by now, often presents with a fever. You could have a little bit of shortness of breath. You could have a little bit of muscle aches, a bit of a headache. A lot of people with COVID specifically have like a loss of smell or taste. That's what makes it a little bit unique. But otherwise, it's like any other virus that you get. Okay, so here's the new information about the new COVID vaccines, okay? So Pfizer, Moderna, and Novavax all made new COVID vaccines that came out in September in the United States. And they just recently came out in Canada because we're very slow here. Or maybe US is just very fast. Who knows? So as we may remember, Pfizer and Moderna are mRNA vaccines. They're able to make these vaccines in a very rapid way. And the advantage of that is it can respond very quickly to the latest things that we need as a population. So in this case, do you see how Novavax is a JN1 vaccine, whereas these are KP2? Well, that's because Novavax had to start making their vaccine like 6 months ago. And at that time, JN1 was their best bet of what strain they need to make. But it turns out KP2 is more what we're seeing at this time. So those vaccines in a way are better, or they're more similar to what we're getting in terms of COVID. That being said, the JN1 is still close. And if you got that vaccine, that's still great. And it's still way better than not getting a vaccine. That being said, you can't get that vaccine if you live in Canada, or at least in Ontario. There is no Novavax in Ontario. I just read this yesterday. So sadly, the Ministry of Health is not procuring this vaccine for this season. I'm gonna sneeze. Okay. Excuse me. Okay, so the Moderna vaccine is the one we're giving the kids this year. So 6 months to 11 years of age have to have Moderna. And the Pfizer and the Moderna can be given to, or if you're an adult, you can have Pfizer or Moderna. Okay. Or if you're 12 and up, Pfizer or Moderna, you'll be getting KP2. And this is a booster and it is recommended. This is what we're seeing now. Okay. So the who is recommended to get the vaccine. If you're on this slide, if you're in the group on this slide, you are strongly recommended to get vaccinated now. So anyone 65 or older, you are higher risk for getting infected with COVID and having a poor outcome. So you are strongly recommended to get vaccinated. Anyone else who falls in these groups, notably pregnant individuals. If you're pregnant, you should definitely be getting vaccinated. Also, racialized groups fall under these recommendations. So in Scarborough, most of our population is racialized. You should be getting vaccinated. There's a lot of factors that go into this, but overall, you qualify for this vaccine and you might as well get it. It's good. So essential workers, indigenous communities, people who have any immunocompromised or underlying medical conditions, respiratory conditions, COPD, asthma, living in LTC. If any of this rings a bell, sounds like you or someone you know, get vaccinated. Okay, strong recommendation. What if you're not in this group? You're still recommended to get vaccinated. It's just not as strong recommendation. Okay, so everyone who's on this call, you are all 6 months of age and older. You should get vaccinated. Okay, you're recommended to, and this is for a booster this season. Okay, so either you have a average recommendation or a strong recommendation if you're in the slide before. Okay, and this just to help you differentiate what things are, just for your information. This is one way to think about it. Notice the fever is COVID and flu, but not cold. Notice the headaches, mostly flu, not cold, sometimes COVID. Flu and COVID are more common or more similar than cold. Okay, so if you have this certain cluster of symptoms, you might be thinking, oh, this is either flu or COVID. That might be a good time to test yourself for COVID. If you have a cold, it's more sneezing based, right? As you look at sneezing, common and cold, no for flu and COVID. That's kind of how I think about it in general. If you're just sneezing a lot and have a runny nose and feel fine otherwise, that's a cold. You probably don't need to test yourself for COVID if that's your main thing and you have no other, like you don't have fever, you don't have cough, you don't have muscle aches, you know what I mean? This is the same thing. Okay. And some people might be wondering when are you most contagious? Well, that's right before your symptoms begin and right after they appear. Those are the times when you're most contagious. And usually, if you have a fever, we're talking about shortly after symptoms appear, right? You don't get the fever at the end of your course of illness. So this is all kind of saying the same thing. So early on is when you are most contagious. Before the symptoms appear, there's no way you can know about that. There's nothing you can do about it. But I guess you can do contact tracing and you can just think and let people know, be like, hey, now I'm super sick. And last night I was just hanging out with these 3 people and we were sharing, whatever food. Maybe I should let them know that I'm really sick now. But otherwise, once the symptoms appear, you can isolate, you can mask up, and you can protect those around you. Okay, so just a little bit of details for those who are pregnant. As you may have figured out by now, pregnancy is a very important time to get all the vaccines. So you should be getting the flu shot and the COVID vaccine for sure. What about the RSV vaccine? Maybe not, because Beyfortus is better than Abrysvo, which means you don't need the RSV vaccine if you're pregnant, as long as you know that as soon as the baby's born, they'll get Beyfortus, and that's even better than the RSV vaccine. But you should get flu and COVID vaccines ASAP. How does this work? You get the vaccine as the pregnant woman, your immune system makes antibodies, those antibodies pass through the placenta, then baby has the antibodies. So then when baby is born, they are protected. Just like how they're given all the other antibodies that you as a mom already have. So these soldiers join the army that you already are donating to your baby. That's one way to think of it.
It's just a question in the chat regarding is Beyfortus still recommended if the mother has received Abrysvo?
Good question. So it is a tricky situation. I believe that you can get both. However, they don't want people to get both. So don't just go off and get it. Like, don't just go and get Abrysvo and be like, I'm going to get both. They are recommending against that. However, if you got it, like by accident, let's say, because you didn't know about Beyfortus, then yes, it is possible for you to still, or your baby to still get Beyfortus. But the guidance is to not be routinely doing that.
And there's another question on the same topic. I am assuming that Abrysvo would be recommended for mothers if they are high risk or chronic conditions. Are you able to confirm that?
What do you mean?
So if a mother has high risk or has chronic conditions, would Abrysvo be recommended for their protection?
No, like don't think that the Abrysvo is not protecting the mom from RSV at all. Okay. It's literally just using the mom as like a vessel for protecting the baby. It's using the mom's immune system to generate antibodies and pass to the baby while the baby is still safe inside the mom at 32 to 36 weeks. It doesn't, if the mom has asthma, it's not like getting the RSV vaccine is going to protect the mom from RSV, because the mom is not going to be 70 years old. So like if you're in your 30s or 40s or 20s, you are not at risk for RSV. It just doesn't occur in that patient population. Does this make sense?
Thank you. I think that clarifies things.
Okay. So yeah, we are wrapping up the presentation. So they start thinking of your questions. But I just want you to know that we're doing a lot at SCHC here about getting vaccinated, and we have VaxFax going on. And this is okay. So I run the VaxFax clinic in case you didn't know this. So this is a SCHC based clinic. We're in partnership with SHN. And if anyone ever has questions about vaccines, I'm the person that you can ask, and I can talk to you one-on-one, doctor to any individual, whether they're a patient or a healthcare worker. So I would highly recommend that you go to this first link, and it will be more helpful than any other resource because I can connect you to anything else as well. Also, I can have a interpreter in 200 different languages, so we can speak your language. Yeah, so just the usual stuff that wash your hands, okay? Let's prevent all of these as best as we can. Wash them thoroughly in the spaces under your nails. Just, pretend you're a surgeon. Use soap and sanitizer in between seeing patients or that kind of thing. Clean surfaces as best you can, especially in the winter. Wear a mask if you're in crowded indoor spaces. And just another thing about VaxFax Plus Clinic on that website. That's how you can book directly into my calendar, and we can talk about things outside of vaccines as well. If you have questions about health, anything about your health, you can talk to me about that. We're going to be called Health Facts soon. So anything you want to know about health, get the facts. The end.
Can I ask a question?